Good morning. Welcome back to the OHSU Effect. Today we're going to talk about something called mirror therapy and phantom pain. With me now is Beth Darnall, a clinical psychologist and assistant professor in the OHSU Department of Anesthesiology and Perioperative Medicine. She is also the president of the Pain Society of Oregon, and she recently won a grant to travel to Vietnam to teach medical professionals and others about mirror therapy so they can in turn teach Vietnamese amputees. Vietnam has one of the highest rates of limb amputation in the world because of landmines and unexploded bombs from the Vietnam War. Good morning, Beth.
Hi, thank you. It's great to be here.
Well, tell us what phantom pain is.
So phantom pain is pain that feels as if it's coming from a part of the body that's been amputated.
And so does this happen immediately after an amputation, or does it last forever, or what?
So most people who acquire amputation do experience phantom sensations and phantom pain. It doesn't become chronic for everyone. For some people, it resolves after surgery. But for a significant subset of people, it goes on to become chronic. And for those people, once it becomes chronic, it can last for decades or it can be considered permanent.
Wow. Does pain medication help at all here?
Not very much. It doesn't work well. So we've really looked to other treatments to help alleviate the suffering of people who acquire phantom pain.
Well, yeah, that leads us to mirror therapy. Explain what it is. How is it performed?
So mirror therapy is a very interesting technique. It was really discovered and developed by Dr. Ramachandran in the mid-90s and has really been a breakthrough in our thinking about pain and how it can be treated. And it's something very simple. It's where you would take an everyday mirror. So let's imagine that a person has a leg amputation and they would take a closet-sized mirror, something that you would get at your local store, and you would hold it across the midline of your body. So you'd want to be in the seated position, and you'd place the mirror so that the amputation site was actually hidden behind the mirror. So that when you look down, what you're seeing reflected in the mirror is the image of having two intact limbs. So even though that one limb has been amputated, when the person looks down, they see no amputation. And then what the person does is they perform gentle movements with their intact limb, and that creates the image or the illusion that they have two functioning limbs. And this is a very important point because we're sending signals to the brain. We're communicating to the brain that we have two functioning limbs that are intact, and that appears to change the brain and can alleviate phantom pain or resolve phantom pain for a subset of patients.
Wow. So how long have you been doing this, and what have you found in your research?
So I got into this area in about 2007 when I treated a gentleman at the Comprehensive Pain Center who had phantom pain. And he had tried medications, he had tried traditional psychotherapy, relaxation techniques. He had tried lots of things and nothing was working. And so I knew about mirror therapy, but by no means was an expert and actually hadn't tried it with anyone. I gave this gentleman very basic instructions that we literally found on the internet. And I, asked him to treat himself at home for 20 minutes a day. And something amazing happened. Over the course of 6 weeks, his phantom pain resolved. He was able to get off all of his medications, his depression remitted, and he returned to work. So his function was restored and his mood improved. And this really got my attention because you don't tend to see these types of improvements in the pain world. This was a really big deal, especially being able to taper off all of his medications. So I decided to learn more about this and developed a study to really test whether people could treat themselves at home truly without the guidance of a therapist, without any special set of exercises. Could people just get some basic instructions, treat themselves, and resolve their own phantom pain? So I ran this study in 2009 and 2010, and the results of my study actually were just published this week in the Journal of Rehabilitation Medicine. And a summary of that is that I did find that the majority of people will treat themselves at home with basic instruction. If you give them basic instructions and explain the rationale for it, they can treat themselves. And about 50% of people in my study experienced improvements in their phantom pain. But when it comes to pain research, we really look for the clinical significance of the change. And so 30% of people in my study achieved a moderate to significant reduction in their pain, meaning that their pain improved somewhere in the range of 30 to 100%. And these were people who'd had phantom pain for, months or decades. There was one person in the study who had phantom pain for 59 years.
Oh my gosh. How long a day does a person have to do the therapy?
So the literature suggests that roughly 20 minutes is the standard for the amount of time, the duration of time that a person should practice mirror therapy on their own. Now, in truth, we don't know what that magical number is. It could be 15 minutes. We don't know. There haven't been enough large studies. In fact, the area is ripe for research. We simply don't know. But we do know that when we tell people to practice for about 20 minutes a day, there is a subset that improves. So we know that can be a therapeutic dose of therapy for many people.
Well, tell us about your trip to Vietnam. Why did you want to go there? What were you able to accomplish?
So Vietnam has the highest prevalence of amputation in the world, and that's due to unexploded bombs from the Vietnam War, and it's also due to motorbike accidents. So there's a huge need for novel therapies to treat amputation-related pain. Combined with the fact that pain is severely undertreated on the whole in Vietnam. And so there was just a really nice opportunity to put together an application to go there and do some outreach and also some research on the technique. So this project was funded by the International Association for the Study of Pain, and I collaborated with 2 pain physicians in Vietnam. And the goal of the project was to go to Vietnam and deliver 3 separate workshops to train and certify physicians, allied healthcare workers, and also trauma workers in the technique of mirror therapy so that they could then train staff in their clinics and also treat patients, teach patients how to treat themselves at home.
Well, just about 30 seconds left. What is next for your research? Where do you see mirror therapy going in the future?
Right. So still focusing on outcomes related to Vietnam and focusing on whether we'll see change in practice and also improvements in patient outcomes. I think one of the nice lessons about mirror therapy is that it teaches us about the power of the brain and how we may harness the power of the brain to change pain. So I think it's just one nice opening towards a completely novel field of exploring how the brain can change pain.
And we're going to put a link to your study on the OHSU Effect page, which is at kxl.com. Dr. Beth Darnall, thank you so much.
Thank you so much, Lacey.